Sjogren syndrome is one of the most common diseases that I see in my practice, rheumatologist on call. So today I decided to give you all the information you need to understand this disease better. In this video, we will discuss the most common 10 manifestations of Sjogren syndrome. Let's begin.
rheumatologistoncall.com.
Hi everyone, I'm Dr. Diana Gurnita, a board-certified rheumatologist and the founder of Rheumatologist on Call. If you are new here, welcome to my YouTube channel where I educate people about autoimmune diseases like Sjogren syndrome or rheumatoid arthritis and many others. So don't forget to subscribe and never miss one of my videos. If you have been following this channel for a while, I'm excited to have you back and share more information with you. Sjogren syndrome is a rare disorder affecting approximately 1% of the population. Between 400,000 and 3.1 million adults suffer with Sjogren syndrome. Females are more affected than males, and many patients with rheumatoid arthritis actually have symptoms of Sjogren. Dryness. The most common symptom of patients suffering with Sjogren syndrome is dryness in the eyes and the mouth. Patients mostly describe dryness of the eyes as itchy sensation, irritation, grittiness, or a foreign body sensation, and sometimes blurry vision or even change in vision. The lacrimal gland secretion from your eyes will decrease over years, and you will start feeling these changes that can become pretty upsetting. Suppose you go to see an eye doctor. In that case, they can quantify the secretion from your lacrimal glands with a test called Schirmer test, where they will put a special paper in your eyes that can quantify the secretion that comes from your lacrimal glands. Dryness in the mouth is also very common in patients with Sjogren. Your saliva keeps your mouth healthy and prevents you from getting cavities. When your saliva secretion decreases, you may experience frequent tooth decay and multiple cavities. You may also experience difficulties when you chew food, when you swallow food because of lack of saliva. You may need to drink frequent sips of water to be able to talk or to be able to swallow. You may have changes in your taste due to lack of saliva. Some patients can develop episodes of parotiditis. Dryness can also affect your skin, and that can cause itchiness. Rarely, the skin can develop a more difficult or a more complicated disease called small vessel vasculitis. Some females will describe even vaginal dryness, irritation, pain with sexual intercourse, and itchiness, which can dramatically affect their sex life. Joint pain and muscle pain. Patients with Sjogren frequently complain of joint and muscle pain. The joints can hurt without being swollen. Usually, the pain is symmetric and it may come and go. Unlike rheumatoid arthritis, Sjogren patients have arthritis that will not deform their joints. The hands, the wrist, and the knees can be affected. About 40% of patients with Sjogren syndrome can have a rheumatoid factor test positive, especially if they complain about joint pain. More rarely, patients could also have a positive anti-CCP antibody, which is a test that we see positive in patients with rheumatoid arthritis. In that case, those patients could have even erosions in their joints. As I mentioned, muscle pain is also frequently seen in patients with Sjogren, and sometimes muscle pain is associated with weakness in the arms or the legs. It is essential to contact and discuss those symptoms with your rheumatologist because Sometimes these symptoms can mimic another autoimmune disease that is called inflammatory myositis. Lung disease. About 20% of patients with Sjogren, they can have lung involvement. Patients can develop upper respiratory infections like sinusitis, and they can also present with a dry, irritating cough. The cough could be due to severe dryness in the airways, due to mucus plug, and even due to reflux that comes from their stomach. Sometimes the patient can see changes in their voices and they can describe hoarseness. In some patients, along with dry cough, patients will present to the doctor due to severe shortness of breath that we call dyspnea. The shortness of breath can initially affect you after walking for a period of time or going up the stairs, but it can also happen at rest. Pulmonary function tests and a high-resolution CAT scan are indicated in those cases. The CT can identify if you have lung fibrosis or what we call interstitial lung disease. Some patients will present with shortness of breath and cough before developing dryness in the eyes or dryness in the mouth. In these cases, the pulmonologist that found the lung fibrosis might decide to test you for autoimmune diseases like Sjogren or rheumatoid arthritis, just to name a few of the autoimmune causes for lung fibrosis. Neurologic manifestations. Many neurological manifestations may occur in patients with Sjogren, from peripheral to central nervous system manifestations, from frequent headaches to paresthesias or tingling in the hands or in the feet, sometimes in one side of the face or other parts of the body, to more complicated situations like transverse myelitis or optic neuritis, which is an inflammation of your optic nerve. Some patients can even present with symptoms that look like multiple sclerosis. And rarely, patients with Sjogren can present with brain inflammation that we call encephalitis. Heart disease. Yes, Sjogren can affect your heart. Chronic, ongoing inflammation can increase your cardiovascular risk. What does it mean? It means that you can develop heart attacks, fluid around the heart, arrhythmias like a heart block, or hypertension, or strokes, or even thrombosis were seen or were reported in patients with Sjogren syndrome. Gastrointestinal tract. Patients with Sjogren can also have difficulties swallowing the food because of the decreased saliva pool, and they can develop nausea, abdominal pain, and gastritis. Some patients can have liver function changes. Some patients can develop primary biliary cirrhosis or some forms of autoimmune hepatitis. Celiac disease was also more frequently reported in patients with Sjogren. Kidney involvement, bladder dysfunction, interstitial nephritis, and kidney dysfunction leading to acidosis were seen in patients suffering with Sjogren. Patients develop an increased frequency in urination. They have to wake up and urinate at night, which will affect their sleep. And some of these symptoms can be confusing because the patient would think that they have a urinary tract infection, which in fact is not the case because the tests come back negative. I actually had a patient that developed kidney problems 5 years before she developed dryness in her eyes or in her mouth. Depression, fatigue, and fibromyalgia. Fatigue is a disabling symptom and can lead to depression as patients cannot understand why they cannot keep up with their daily activities, why they cannot keep up with their families, and that would lead to depression. And depression is most likely a response to this chronic disease, chronic inflammation. And some researchers actually believe that depression is a consequence of this inflammation affecting the brain. Many patients with these symptoms will be diagnosed with fibromyalgia when they in fact suffer from Sjogren symptoms. Hematologic manifestations. Patients with Sjogren can develop anemia, low white blood cells, elevated gamma globulins, cryoglobulinemia, and they have an increased risk for lymphoma. Anemia is most likely induced by chronic inflammation. Still, there may be other causes that you need to discuss with your rheumatologist, and that's why you will require a very thorough evaluation. The white blood cells can be low, but most times does not increase your risk for infections. Elevated levels of immunoglobulins, especially IgG, are seen in about 60% of patients with Sjogren. In these patients, we also see elevated rheumatoid factor and positive SSA and SSB antibodies. We will talk in another lecture about the lab tests that we need to follow in Sjogren patients. In patients with monoclonal gammopathy, meaning there are certain abnormal proteins in the blood, we need to carefully evaluate you, as there could be an increased risk for multiple myeloma or lymphoma. These are two types of blood cancers. Lymphoma. Patients with Sjogren syndrome have an increased risk for non-Hodgkin lymphoma compared to patients that do not carry this disease. The prevalence of lymphoma increases with time. For example, following diagnosis was 4% during the first 5 years of disease, was 10% at 15 years following the diagnosis, and was 18% at 20 years following the diagnosis. So if you notice skin changes, enlarged lymph nodes, enlarged salivary gland, you should call your doctor immediately. As a rheumatologist, I educate my patients extensively about all these changes, and I do follow them regularly. If you want to learn more about Sjogren and other autoimmune diseases, please watch my channel, as I will continue to share my knowledge with you. Remember, these videos are just for educational purposes, and they are not supposed to give you a diagnosis or to give you a medical evaluation. If you like the content of my videos, please don't forget to like, share, subscribe, and press the notification button. I will continue to share with you more information as we go. And please leave your comments and your questions down below in the comments section. Thank you, and I wish you a wonderful day.
rheumatologistoncall.com